My name is Kathlene Coleman, and I am about to perform my informative speech. And so here's my audience. Okay, every one of you have probably had the occasion to be in the room with a woman that is having a baby and in labor. And so today I want to talk to you a little bit about interpreting or reading fetal monitor strips. So my speech today is fetal heart monitoring for real people. Now notice that I say real people as opposed to unreal people. That would be healthcare professionals such as doctors, nurses, and midwives. So what I want to talk to you about today is the tracing, which is a piece of paper that prints out from the fetal monitor, and healthy signs of a baby and babies that could possibly be in trouble. So let's talk about the tracing a little bit. So the tracing is actually just the baby's heart rate printed on a piece of paper. Now most people think that a heart rate looks like this on a piece of paper. But in fetal monitoring, it actually looks like this. So as you see, it's a line with squiggles on it, big squiggles and small squiggles, and some rolling hills. So according to Kathlene Rice-Simpson and Patricia Meehan in the text Perinatal Nursing, a normal fetal heart rate is between 110 and 160. The tracing, or the baby's heart rate, is a squiggly line, which is the average over time, and it's called the baseline, which is represented there in that line. Now, the rolling hills at the bottom are contractions. So now that you've seen the heart rate, let's look at this again. Again, I said squiggly lines. So the squiggly lines, the small squiggly lines there, represent the baby's heart rate as far as the variability. The squiggled part is the variability, and that shows that the baby's brain is working well. The large squiggles are called accelerations, and it represents a rise in the baby's heart rate above the baseline. Those show that the baby's heart is working well and that the mother's placenta or afterbirth is also working well. So, if you have squiggly lines and rises above the heart rate, then that shows that the baby is doing well. Those are signs of a healthy baby. So let's talk about signs of a baby that could possibly be in trouble. So basically it is the absence or the opposite of what makes a baby healthy. So if the heart rate is above or below 110 to 160, or there are no squiggly lines as you see in these, then that shows some concern for the baby's heart rate. Now, if you see squiggles that are below or dips below the baseline fetal heart rate, then that is an area of concern. It shows that the baby may not be getting enough oxygen, and we might have to do something about that. So if you see a fetal heart rate tracing that looks like this, then you may really want to show some concern because it has decels below, or the dips below, which are called decelerations, way below the baseline fetal heart rate, and the nurses or medical professionals may be starting to work with the patient at that time, providing oxygen for the mother and baby, providing IV fluids, or possibly even talking to the patient about surgical delivery of the baby called a C-section. Now, there's another way to tell if there's concern for the baby. And that would be if your doctor looks like this. So, that being said, I want you to know that most babies come into this world with little or no difficulties. So, according to Dr. George McConaughey from University of Washington at St. Louis, Missouri, he estimates that only 5% of all cesarean deliveries are emergencies. So that means that most babies will come into the world in the normal fashion. Now, through what you've learned and what we've talked about, you should be able to dazzle and amaze your family and friends with all of this information at the bedside with a woman who is in labor. So if next time that you are there, you will know that in conclusion, we know that if the heart rate is between 110 and 160, it has a normal baseline rate between those two numbers, that there are accelerations, which are the squiggles that go above the baseline, and that the baseline rate has squiggles, then we're talking about a healthy baby. And that's what we want at the end. So the doctors and nurses will work to make sure that that fetal heart rate stays like that. Because in the end, this is what we want: a healthy baby and happy, healthy parents. Thank you. Now we're going to show the audience again.